You are about to enjoy a production of the Ella Wellness Network. This is Wellness Fixes the Pod. I'm your host, Dr. Kelsey Vig, and I'm so happy you're here. Welcome to the Wellness Sisterhood. Today, we have a guest on the podcast that I'm just so excited about. She's a registered dietitian, certified exercise physiologist, certified sports nutritionist. She has her master's in exercise physiology, her PhD in human movement science. She's one of the top researchers when it comes to female-specific nutrition, training, and performance. And she has helped to really pave the way for how folks like me on the clinical side of things approach female health and wellness. So Dr. Katie Hirsch, welcome to Wellness Fixes the Pod.
Hi, thanks for having me.
So before we dive in to all of the fun, sciencey stuff that I definitely that's where I would love to learn from you. What would you say is your broader mission in regards to your own research?
Yeah, so I call my lab team, we're the Sustain Lab. And so broad level, we focus on how can we use exercise and nutrition to sustain health and performance across the lifespan. And so right now, especially really focused on how do we focus on women. I do a lot with body composition, metabolism, and there's just so many stages across the female lifespan where those things change. And it not only impacts women's health and our ability to perform at our best, but also how we feel about ourselves. And so want to make it better for all of us. There's a lot of hard things we have to do in life anyway, let alone deal with those things. So yeah, that's kind of what we do.
That's awesome. I feel like I'm tearing up. I'm like, oh my gosh, my people, this is my total deeper why behind my health and wellness too, is I blame it on my need for self-control and my need to be in control. And with that comes my health and wellness and knowing different things and planning and being able to prepare for something pregnancy, postpartum, menopause, all of these things, understanding and knowing about them so that I can prepare my body now to where I can handle whatever I need to in the future too. So it's my need for control, but I'm huge into my deeper why revolves around what do I want to do in my 80s, 90s, I want to be able to ski as long as I can. I want to be able to pick up grandkids. And so how can I help my muscle mass and my body composition and my fueling right now in order to affect my long-term goals. So we will get into all of that, but let's start with female-specific fueling and nutrition. What are some of the myths surrounding how we should fuel as women, and what are you finding about female-specific nutrition and training through your own research?
Yeah, super good question. I think one area of women's health, nutrition that I've been involved with for quite a while, back to when I was a grad student working in Abby Smith Ryan's lab at UNC Chapel Hill, was really the concept of kind of fasted exercise. So especially in females, there's a lot of reasons we might exercise fasted, but I think there's kind of that prevailing idea that if I'm trying to lose weight or change my body comp, if I eat less calories and exercise more, that should work the equation. And at a high level, that does. But a lot of the work I did there and continue to think about now is really that's just not totally true for women. And especially in the world where we're talking about energy availability and how so many females are at risk for low energy availability and RED-S and kind of those situations, that trickles to fueling around your exercise. And so a lot of the data research we've seen is really eating something before you work out and going into that workout well fueled has so many important benefits, especially for women. The data we've seen doing exercise fasted for women specifically just doesn't result in quite the same effects as if we do it fueled. So a few examples, we did some studies comparing if I consume carbohydrate or protein before either a high intensity workout, a resistance training type workout, aerobic type workout, didn't matter what workout you were doing, getting some fuel in before the workout ultimately helped improve your energy expenditure after the workout and your utilization of fat after the workout. All of that was improved if you consumed some protein before your workout compared to the carbs. So protein before the workout helped improve how many calories you burn and fat use after the workout. The other thing, and we've shown that in a few different studies, getting some protein in before compared to after. Before seems to be, again, metabolically more advantageous when we're, again, trying to enhance that post-exercise window. Can we keep burning some calories after the workout and really promote some fat utilization? So then in addition to that, when we go into the exercise more fueled, we can also do better in that workout. So if I feel better going into it and I have the fuel to actually do the workout well, potentially at a higher intensity or get a few more reps out of it, then you're helping the whole situation in general. Your training feels better. You feel like you handled it better. So you're excited to do it again next time. So there's a dual piece of we get more out of the workout, which can help my muscle and body comp. It's helping after the workout. And then I just generally feel better. And it's not such a chore to get to the gym because I don't feel good while I do it. So lots and lots of good benefits. So I encourage all women. It doesn't need to be like a full meal per se. But if you can get some kind of carb protein type snack 30 to 60 minutes before, depending on kind of what your gut can handle, that is a really great way to go. And then soon after, we just want to get some recovery started. And then I always say, as soon as you can get home and have a full meal of some sorts, that's perfect. So just trying to work some of that in can, help with a lot of things.
Yeah, I feel like recently I've actually, because growing up, it was always like, okay, carbo load before. And again, my dad was like, okay, carbo load the night before, like we're eating spaghetti, like spaghetti on spaghetti before swim meets and all of this. And I was going to ask, like, what's that time window, like what, but 30 to 60 minutes before. And
well, so I'll say carb loading's a little different. And that's something specific if you're someone doing long endurance exercise. Some of our cyclists are long distance runners. If you're doing lots of swimming, that can make sense. But even how women load carbohydrate and that glycogen in our muscle, that situation, yes, you want to get some in before, but really we need to start the carb loading process days before. It just takes a little longer in females to build up and do that. So that's a whole nother realm. And that's why it's so important when you're thinking about like information that's out there on social media, on the web, as you're listening to people on podcasts, being really tuned in on who are we talking about and then what's the goal. And so the goal is very different if I'm trying to maximize sport performance versus if the goal is health, wellness, and changing my body comp. And so this literally just happened the other day. Like my parents called me and they're like, what amino acid supplement can we buy? And I was like, well, first, hold on. Are we talking about mom or dad? Who's taking this supplement? And then I was like, okay, so my dad's like training for a cycling event and my mom just wants to be healthy. So it's like they both ultimately wanted to take it, but we had to talk about, well, how are you using it? What's the scenario? How can we maximize? So yeah, all that's very important. And it's easy to get caught in the glamour of social media, but being very specific of what's my goal and what am I trying to do? And then what's going to best fuel that.
Yeah. And I think that's a very like important distinction too. And like a lens to look through when we're looking at health and wellness stuff that's spread on social media is like, yeah, exactly. What are the person's goals that they are sharing that information for? Who is it for? Because I know for me, a lot of the like intermittent fasting, like you had mentioned, or fasting, like time restricted eating in general, I learned a lot about that from the Dr. Peter Attia and Chris Hemsworth documentary. And so I was like, oh, fasting, like that's what I need. I am not Chris Hemsworth. My goals are not Chris Hemsworth. I do not have the same physiology as Chris Hemsworth. So knowing that in hindsight too, like I've recently, probably over the last 4 months, been more purposeful about fueling before my workouts and actually like trying to get in that glucose and that protein, like the carbohydrates and the protein before, because of all of the research that you guys are doing and like just me learning more about that. And I'm like, wow, I feel way better. I'm like, I'm not trying to be this massive athlete, like, again, I'm an everyday athlete. I'm just trying to stay healthy and maintain rather than like go on some, the Leadville 100, like some sort of long endurance based race. So it was, it's nice to experiment, but it's also nice to know like who's the target audience for certain things, which is why I appreciate you coming on and giving us insight about this, because I do think that as soon as I started realizing like, oh, my body needs glucose in order to like even because a lot of
Yeah.
times I would focus on it, like especially protein post strength training, right? It was always like that was my thought and understanding was like, okay, if you work out, make sure you're getting that protein in subsequent intervals after. There wasn't
Mhm.
as much a focus on pre like having protein before the workout. And so since I've started doing that, I have noticed exactly as you said, like just I can get those extra sets in. I can get that, like I feel better during my endurance training if I'm doing, some of the carbs before. And so it's feeling good in your body and understanding why we need certain things
Mhm.
before the workout in order to
Yeah.
utilize and
Yeah.
actually feel better. So
And I love that you, yeah, kind of brought some of that up because that's something, especially in health and fitness space, there is a good bit of talk of protein and there's a lot of good benefits of that. But specifically, if we're trying to perform and do really well in a workout or a sport, carbohydrates, that's our fuel source. That's, yeah, what you need most, what your body can use the best, and what's going to help you do best in that performance scenario. And so, honestly, like when I speak to like our sport dietitians that are working with college athletes, and the number one thing they're working with female athletes is A, are we just consuming enough calories? That's step one. You need calories to fuel the workout and the exercise and the recovery. And then B, enough carbohydrate. So there's a lot of female athletes that restrict that or don't want to overdo it for multiple different reasons. But again, when you're burning a lot of calories throughout the day, those carbohydrates are really important. And so actually in the research on like low energy availability and red S and all the negative things that can come from those situations, some of the research now is suggesting it's not just a calorie and energy thing, but it's also a carbohydrate component. And the two often come together in women. But there's some to suggest it's also just too low of carbohydrate. So, yeah, a very important thing to emphasize. And again, it's not like we have to go crazy and eat an entire bowl of pasta or something, but we need to make sure we are consuming it.
yeah, no, definitely. Do you have like a quick like calculation or something where it's like, okay, let's say this is my weight in kilos. I'm just like an everyday female athlete. What percentage of my pre-meal 30 to 60 minutes before should be carbohydrates versus protein? Like, is there a quick sort of like, okay, if I'm thinking about optimizing some of my workouts and performance in this way, and I am, you know, like a certain amount of kilos or pounds, is there a certain calculation for that to help us know based on, a 30 to 60-minute strength or cardiovascular based workout?
Yeah, I mean, I think for the average person, a lot of times I think about it in kind of a ratio type of a thing. So going into a workout, I would shoot for a 2 to 1, 3 to 1 carb to protein ratio. You probably want a little bit more carbohydrates, especially if I'm an athlete. Definitely, I would emphasize that. Maybe up to a 4 to 1, kind of depends. If I'm an endurance athlete, we want to up that amount. Afterwards, we might lower that a little bit and go more for a 1 to 1, 2 to 1. Um, and so, like before a workout, if we're going to do 15, 20 grams of protein, we probably want to do like 40 ish plus grams of carbohydrate. That would be a 2 to 1 type of a ratio. Again, afterwards, we usually want to go for about 30 grams of protein. And so matching that with at least 30 grams of carb, because we want to then replenish the glycogen stores. So that's kind of how I approach it. Overall, across the diet, we want to stay kind of in that 45 to 65% of our calories from carbohydrate type of a range for most general purposes. If I'm an athlete, I push that on the higher end of the spectrum. If we're just talking about everyday health, wellness, we maybe go more in the middle. And then if I'm trying to lose weight or we're dealing with some pre-disease type stuff, we might lower that. So it kind of depends on the scenario, but those are maybe some basic guidelines.
No, that's awesome. Yeah, just something like quick to like, okay, hey, I'm getting 10, okay, 20, like just some quick calculations because it helps me to even know for myself of like how much should I be? Like, I don't know. She told me to eat carbohydrates and protein, but like, do I eat this like bowl of
Yeah.
oats? And,
I mean, some super just like easy examples. Like sometimes I just do like a higher protein yogurt, just like a cup of yogurt before I go do like a lifting workout, or like a pretty standard protein type granola bar that has some of both of those in there, or sometimes someone the other day suggested like Gatorade mixed with orange protein powder, and it makes like kind of a creamsicle, or like it was vanilla whey and orange Gatorade, and they were making like a creamsicle flavored beverage. So there's lots of ways to kind of mix that. So
yeah, that's awesome. Just a few ideas for all of us who are like, okay, I want to try and like optimize some of this.
sure.
So tell me like what is the difference? Like why is it different for women to actually need to be fueled and like have some of these nutrients before versus men? Like what is it physiologically that changes when we're talking female to male when it comes to fasting and then like making sure we as women are fueled before our workouts in a little bit better of a way?
Yeah, that's a good question. So you kind of mentioned the intermittent fasting earlier, and honestly, all the data in intermittent fasting is done in men. So I think that's it. We'll come back to that. But men's bodies just seem to handle kind of fasted scenarios a little bit better, maybe is. And so if we think about female bodies are just so sensitive to energy levels and those carbohydrate levels. And I like to think about it, taking it from a survival perspective. If we just survive, reproduce, that's usually the goal of most organisms. As females, we're doing the reproducing. And so we not only need to like keep ourselves alive and be very resilient, but also keep a second human individual alive and be very resilient for that. So our bodies are very good at holding on to the energy that we have and being very quick to adjust when we're in a situation when maybe there's not enough energy. And so that's super great in that situation. But then put us in today's world. And if we're chronically not getting enough energy, our bodies respond to that and we'll start to do things to conserve. That's a stressful situation. And so it'll do a lot of things to try to hold on to what it has and protect that. And so there's research out there that shows, long-term, not good for females. We kick into those mechanisms a lot faster. They happen in men as well, but their threshold for when that type of stuff starts to happen, for example, like red S, that happens in males and females, but the threshold of when we start to see those symptoms and the less positive pieces of that show up happens sooner in females when they're in that deficit, usually compared to males. They can go a little bit longer and go into a little bit deeper hole before the issues start to show up. And so, we're just way more sensitive to that. And so by making sure we are fueling our bodies, and especially when we put it into a eustress situation, exercise is a good stress, right? But it is a stress and we're still taxing the body. And so we want to make sure we're supporting that. I think a lot also, just to take it further, a lot of females forget it's not just the workout that happens in a day that causes stress on your body. You go to work and have to do work and there's work stress, and maybe you have kids and you're juggling that, and that takes energy and brain thought. And so maybe you're not getting then good sleep too. And so there's a lot of things that start to spiral and add to this maybe more stress-filled situation. And so it all starts to compound. So making sure we have the energy to make it through all those things is very important. So again, like to bring it back to the intermittent fasting, very little data in females specifically on intermittent fasting, time restricted feeding. I think women need to be very careful with that, especially those that are premenopausal, because we're starting to talk about these long time periods of fasting, which can be good, fine, a onesie, twosie, occasionally. But I think when we start doing that chronically, are we able to get and compensate for that in the eating window? Is kind of a question. And so for an athlete, especially when there's really high calorie and fueling needs, not the approach I would take necessarily. So those are my 2 cents there.
Yeah, and I think a lot of people from, again, like everyday people, like the everyday female who's not a super high level athlete, a lot of the stuff that they're hearing on intermittent fasting is about sort of wanting to reach certain body composition goals or body recomposite. Like they're trying to increase their muscle mass, decrease their fat mass. And intermittent fasting, they, have heard, oh, if we just decrease that time, that's a way to restrict the amount of calories in general, and I'll level it out that way a little bit. Where I think
Mhm.
it's important, like what you mentioned earlier, understanding that fueling before and fueling our bodies in the right way actually helps our metabolism, long after that, like workout or whatever it is.
Yeah.
Because a lot of people, like, okay, you're intermittent fasting, you're restricting your window of, or fasting in general, you're restricting your caloric intake possibly during that
Mhm.
time period. You're probably increasing your exercise because in some way, because that's also what you've heard helps with body composition and fat loss and just certain things like that. And it's like, okay, but then your body's going to kick into those like survival stores a little bit sooner because it's like, oh, hang on,
Mhm.
we are, hunting and gathering food. Like we're exercising, we're to bring it back to like the like evolutionary standpoint, I guess. It's
Yeah.
like we're stressing our bodies in some way. We don't have the stores. We're gonna start breaking down things that we don't necessarily want to break down because we do want that for our bodies and our physiology, and especially if you do have body composition goals. So I think switching our mindsets, and I think a lot of people are starting to, but I think switching our mindsets to be like, okay, no, fueling actually does help me reach my goals because, like you mentioned earlier, we do get into that low energy availability state. So, kind of expand on that a little bit, and then red S, you're like, kind of go into what that means,
Mhm.
and then low energy availability. Like, what are some of the consequences in the short term for low energy availability states, and then also like long term, if we are
Mhm.
underfueling long term and we just don't know that we are.
Yeah. So red S is reduced energy deficiency in sport. And being honest, it's kind of hard to quantify. Basically, it's an equation where we calculate where are you at kind of in an energy status standpoint. So, especially a part of it is the low energy availability. And so for that, we have to measure what's your energy expenditure during exercise? How much are you burning? And then we have to measure how much calories are you taking in, and then all of that relative to your fat-free mass, kind of equated to your muscle, the metabolic aspect of your body. And so those things we can do the energy expenditure part pretty well. We have fitness trackers now. Everyone wears a smartwatch of some sort, or a ring, or yeah, we have all these new trackers, and we can usually get a pretty good guess of your expenditure. Diet's a lot harder to quantify. Really, we only have diet logs for that. And we know there can be a lot of error in that. How well do people report? Do they report everything? So that part's a little bit variable and harder to nail down. So that's kind of how we define low energy availability. It's difficult to measure, but the concept makes sense. So by doing that, if you, yeah, are in low energy availability for too long, we're going to start on the more extreme end of the spectrum. If you're not getting the energy to meet the needs of your exercise, and then that means there's not enough left over to fuel all of your body processes, um, we can start running into your body kind of does go into that protection mode. We start to see a lot of fatigue, increased risk of injury, more likely to get sick. Your progress in your performance and your workouts won't be as good. It'll either plateau or start kind of going down. We might see some weight loss from not just body fat, but also maybe some muscle decline, depending on how long this goes on. For too long, like bone density can start to get compromised in females, stress fractures go up, losing menstrual cycle. Basically, the body just is going into conservation mode all the way, but lots of things that aren't necessarily great for health performance. And so, obviously, we want to avoid all of that. But I think a lot of people think about that situation in the more extreme scenario and the situation of, well, someone with that has an eating disorder, or this has been going on for a long time. And that's true to an extent. This is a spectrum. And so I think there's actually a lot of women that are kind of in the not severe end of the spectrum, but in this middle range of they're consuming enough that we're not getting stress fractures necessarily. And maybe the period comes and goes a little bit. But a lot of women like fatigue is so, so common. And a lot of it is stemming from we're just not eating enough throughout the day. And I'm guilty of that sometimes. Or things get stressful. And so I just wasn't able to consume enough in a day, or, meetings filled up the day, or whatever it is. And so I think a lot of women actually sit in a slightly acute phase. And in that very acute phase of low energy availability, I talked about fatigue a lot. That's a really big one. But we can also start to see maybe some disruptions in sleep quality. That can be just my ability to stay asleep and really recover during that sleep might start to get a little bit compromised. We start to see changes in like GI. So maybe you're starting to get a lot of like gut doesn't feel so good, some dysregulation, maybe your stomach's getting more upset than normal. Your appetite can change. So actually appetite suppression, if you're not feeling as hungry or craving food like maybe you normally would when you're hungry, that can kind of start to go down. And so those are some like more acute and less severe versions of it, but still as a version of low energy availability. And so being aware of those things can be a sign like, hey, I need to find some spots in my day to make sure I'm getting the right amount of energy and fuel. And then especially if we're going to be in a calorie deficit, like needs to happen if you're going to do weight loss or try to change some body comp, some of that needs to happen. But that's where putting the nutrition closer to your workout and being strategic. Now can I get the most out of that workout and get the best benefits and make sure I'm going to recover from it the best, can help with all of that. So it's then in that situation being strategic with all of your pieces.
Yeah, I think that's super important because, like you said, it is a spectrum. And when I think of low energy availability, it's like, oh yeah, I think of the extremes, right? Like that's not me, but like you said, we all probably fall more in that middle range where I do feel like some of the time, I think that's why back, like maybe 6 or 7 months ago when I was like trying the fasting and different things, it was like my workouts, I wasn't able to like, I noticed it a lot in my workouts where it was like, okay, I'm not feeling like I'm recovering as well. Like it's feeling harder. And I know that also differed based on the phase I was in my menstrual cycle, but even my thought processes too. Like I noticed my ability to find words, like,
yeah, that's what I forgot about, the cognitive pieces,
yeah.
like your word recall or just brain fogginess or attention span goes down, all those pieces.
Yeah, I've noticed hugely where I'm like, I know it, and that's what's cool about like being more in tune with your body and experimenting too, because we've all probably gone through various phases of different experimentation with our fueling and our training. And it's like, okay, I know my body doesn't feel good with this and it does with this. So why might that be? And so, yeah, just being more aware of what low energy availability is and the consequences it has on our bodies now. And then also, yeah, in the long term where it is like the stress fracture stuff and some of the like, yeah, more bone mineral density, all of that kind of stuff. So switching gears slightly, I know you do a lot of research on creatine and supplementation, and I get so many questions about creatine specifically. And I really do feel like creatine, previously you'd think of the gym bro, like all of the, like the idea surrounding creatine has gone from like gym bros to now a lot of girls, I do a lot of like live outreach events and stuff, and so many girls are starting to have questions on creatine about like, what about the negative side effects that I hear about the bloating, the like nausea if I drink or if I eat too much or whatever. Like, what are your thoughts on creatine, first of all? Like, how does creatine help us or hurt us as women? And then what do we need to look for when it comes to supplementing with creatine?
Yeah, all good questions and very similar to what I get from my sport nutrition students in class. Because I think creatine, there's been a rise in the conversation. And so, which I love to see, but of course, there's always myths and misconceptions to clear up, and everyone has questions. So, before I dive in, there are some really great reviews on creatine. Any situation you can think of, there's been some really great review papers that have come out. Some key ones to maybe look up, and I can share these with you later to maybe link people to. But there's a couple myths and misconceptions papers that specifically pulls out these most common myths that people often hear or have questions about. And that was put out by the International Society of Sport Nutrition, written by a whole group of researchers who are key experts on this. So that one's a good one for some specific myth busting and questions of what's actually going on with that. And there's another really good one that specifically focuses on creatine for women's health, written by Abby Smith-Ryan. And so it also goes into good information about female-specific benefits or uses for creatine. So first off, creatine is probably one of the most studied supplements. Caffeine's up there pretty good as well, but lots and lots of data. And we're just seeing more all the time and the benefits it can have across the body. As far as negative effects of creatine, if you're dosing it appropriately, as of right now, there's really not that many downsides to taking it. So by doing some really standard dosing, which typical recommendations about 5 grams per day, you can do a loading dose, but if you take 5 grams per day every day, you'll saturate your muscle stores. And so creatine itself is an amino acid. It's found naturally in meats, and it's stored in muscle. And so you don't get this if you're not consuming meat of some sort. It's not found in plants. It's a muscle specific amino acid. So vegans, vegetarians often have low amounts of creatine in their body because they're not getting it in their diet. But creatine in the body is one of our immediate fuel sources. So if I were to immediately jump out of my chair and need to run out of the room, I would be using creatine to help do that. It's a really rapid way to resynthesize ATP in our body. Anytime we do anything fast, quick, explosive, less than 3 seconds, that uses your ATP creatine system. And so, like you said, started with gym bros. They noticed it was helping them increase muscle mass, get good gains. And the reason for that is when we have more creatine in our muscle, it helps with that energy process. And ultimately, it'll help me with, can I get a few more reps when I'm trying to do like a reps to fatigue? Or does it help me lift just a little bit more? And so ultimately, it's helping you get more out of the workout. And so that's why it's really beneficial, especially for strength, muscle gain, power generation. Sprinters would really benefit from creatine. Those big explosive movements rely on that. So that's kind of where its main benefit started. We're starting to see, by taking creatine, again, through that muscle benefit piece, it's helping minimize loss of muscle as we continue to get older. So that's really helpful. We're seeing benefits to bone. So that's a big deal for women, especially as we're aging. In general, I simplify things and say if it helps the muscle, it's going to help the bone. Muscles pull on bones. So that's really helpful. But it's helping again through, if I can lift a little bit more, if I can get a little more muscle growth, that all helps pull on the bones and keep them healthy. But there is some data that it might be helping with some of the actual bone activation pieces. For women specifically, so women tend to have lower creatine stores compared to men. And so really, we can't get enough creatine in our diet by itself. You'd have to eat an amount of protein and meat that just is unreasonable for a human being to consume naturally. And so much more efficient to supplement and much more efficient for loading the muscle. And so supplementing for women really helps make sure we're going to saturate the muscle and get what we need. There's some really interesting brain benefits. I think this is a really cool area of research for creatine. And we don't have good dosing for the brain benefits yet, but it seems in women especially, creatine can help offset or reduce symptoms of depression. So if you're someone that maybe experiences depressive type episodes or moods throughout menstrual cycle, that could be kind of helpful. If you're someone who maybe chronically experiences some of that, there seems to be some interesting data that more creatine helps offset or reduce some of that with and without medication. So that's a really neat, interesting area. Some of the work I collaborated with coming out of Abby Smith-Ryan's lab was, what if we loaded creatine? So you can do a loading dose, which is we get in 20 grams per day, split into 4 doses throughout the day. We do that for 5 days to really quickly saturate the muscle. And so they wanted to look at if we did a loading dose, either during the follicular phase or the luteal phase, does that have any benefits? So some big things that happen in that high hormone luteal phase, when estrogen's high and progesterone's high, sometimes we see women struggling to do those explosive movements. They just don't feel like they can really max it out, peak, do repetitive high intensity stuff. It just, you feel maybe slightly sluggish. So they were targeting that. Another thing women complain about is sometimes you get maybe bloated and you're holding water and you feel kind of soft during that type of phase. That can be going on. And so, so they were looking at first and foremost targeting that power deficit. And their data would show that by loading creatine during that high hormone luteal phase, it did offset power deficits that happened during that time. So that was a key thing. They did then a secondary analysis to kind of look at that water piece. Not only do women maybe feel puffy during that time, but a fear of creatine is, I'm going to gain weight. So what they looked at was, do you gain weight? And what's actually happening with that water piece? And so what they were able to show is actually creatine pulls water into the muscle. And so when it does that, to store it in the muscle, it needs water. And so it pulls that water with it. So actually it helped improve the distribution of water. And so if you're someone that maybe feels puffy, bloated, like you're holding water in your extracellular space, it helps pull it into the muscle where it actually has better benefits and is more useful. And then you can help reduce some of that symptomology that's happening. How much weight do you gain with that? It's not anything drastic. Some people may hold a little bit more than others, but it's coming from water and it's moving that distribution of water better throughout your body. So it's not like you're gaining body fat, which it would be the bigger concern with a weight gain. And so those are some key things. And so, I mean, you could go on and on and on of some benefits, but those are some key ones that we focused on more recently.
So just hearing you talk about how creatine kind of like pulls in water into the musculature too, and me being like a pelvic floor PT and working with pregnant women and even postpartum, I'd be interested to know, or, I don't even know if it's there yet, about researching. And again, research on pregnant women is just like hard and difficult. And
oh gosh, there's benefits though.
Yes.
There's
Okay.
there's a researcher, I believe she's in Australia, but there's a whole position stand that she kind of led, and she's looking at there are benefits to both mom and fetal health with some of the brain development. So the brain actually utilizes a good bit of creatine. Anytime we need to do, if you think about it's good muscle wise for like that rapid, powerful movement. If we translate that to the brain, when I need to do rapid decision making, that requires maybe some extra creatine. And so some of those quick thought processes are recall or thinking on the fly. And so there's cool data that if you're sleep deprived, maybe having some brain fog type stuff, things where you're maybe not in your best cognitive state, creatine can help offset some of that. So I always think about like moms postpartum not getting enough sleep. That could help a little bit. But there is some neat data on what it's doing for maybe both mom and baby. It's hard to study because there's a lot of safety concerns, but that is a growing area that seems to have some benefits.
That'll be really cool. I'm thinking of so many new things now, especially with the reaction time stuff and like, balance and fall risk as we age and stuff. It's
Yeah,
like, hey, how
for
much
sure.
more are we going to be able to understand how creatine, just as a sole supplement, even without all of the like practice and training that goes into that. So that's super cool. So another question I get asked a lot is like what to look for when purchasing creatine. So I know with supplementation, I just feel like everyone has a little bit of a hesitation on because of just lack of regulation or not knowing who to trust with it. So is there something that we should look for when buying creatine that you're like, okay, look for this certification, or hey, any creatine monohydrate, like that's good. Like just sole creatine monohydrate. So what should we be looking for when it comes to like purchasing creatine?
Yeah, yeah, really good question. So any supplement, I would say you want to look for something that's third party tested. And so usually they have some sort of little label or seal there's some from the NSF, the National Science Foundation. There's a little green check or a little yellow check that a lot of times informed sport choice come up on a lot of sport supplements. So there's a variety of those. But what that means is the company has taken an extra step and paid money to send it to a different lab to verify that it contains what it says it contains in the amounts that are listed on the label. And so there's good supplements out there that don't have that. That costs money. So they can't do it on every single supplement all the time for the company. But that is a way you can really make sure a lot of your bigger, more reputable companies, there's less of a concern usually about it being tainted or something. But that's a good way to check. So with creatine, yeah, you just need a straight creatine monohydrate. There doesn't need to necessarily be anything else in that supplement. Sometimes they'll combine it with other stuff, but really you just need creatine monohydrate. You can get it as a powder. I really like the micronized version just because it mixes in with liquid better and is a little less gritty. If it still doesn't mix all the way and you don't like that grittiness, we now there's been a big rise in creatine gummies that are out there. And so those can be a really good choice, easy to pop in and chew. There's also pill form. If you're someone that just wants to knock them down and move on. Sometimes we get pill fatigue, but pretty much now we've got it coming in all kinds of forms. Really, you just want to, whatever you're going to mix it with, if you're going to do like the powder form, you just want to make sure you're consuming it relatively quickly. It does dissociate in water. So sometimes people will ask, can I mix it in my coffee? And sure, if you want to, just make sure you're drinking your coffee like within 15 minutes. If you're someone like me who sips on it all morning, maybe not a great choice. So just making sure you're getting it down. Otherwise, that's pretty much how it goes. Time of day doesn't seem to matter. The data right now just says as long as you're taking it daily. Sometimes it gets put into a pre-workout. That's not going to make a huge, huge difference. But if it's how you're taking it every single day, then it'll build up over time. So that is an option, not like advocating for a pre-workout necessarily, but you'll find it in there sometimes along with a lot of other stuff. But really, if you're just looking for the benefits of creatine, just a straight creatine monohydrate is the way to go.
Perfect. Yeah. It always, like, probably every event that I've done, someone has asked me that question. So I'm like, you know what? I'm definitely not the expert for this. Let me ask someone who is. So switching gears a little bit, and for the last little bit, I want to, and again, this is a topic we could talk for hours about too, but the menstrual cycle. I love the menstrual cycle, but from just even like a broad perspective, knowing that we only have so much time left, but why is the menstrual cycle something important that we as women should be concerned about? And why should we use it as a lens to look into how we train, how we fuel, our motivation, our mindset, all of that?
Yeah. So the menstrual cycle, and specifically like your period, is a very good sign of our health. It is a very clear reflection of women's health. If those hormones start to get depressed, if we lose our period, those are signs that our body is under some excess stress for a variety of different reasons. And it's trying to conserve and protect itself by eliminating that. And so I always say, yes, having your period, not everyone's favorite thing in the world, but it's a very real sign that my body is healthy and doing what it's supposed to be doing. And so I think that's powerful. Guys don't get that. When they have like red us, they don't have that to go off of. So it's harder for them to maybe know when that's starting to happen. Versus we have that very real signal. And so, yeah, you want to maintain relatively good hormone balance. And so a lot of that just then is a sign of, is my body healthy, going to respond well to exercise? It can give you a lot of insights on, maybe strategies to alter your fueling. I always tell women to start with, because there's a lot of interest in menstrual cycle and do I need to do this? Do I need to do that? And do I train different? And in general, we don't have clear research that says you need to train different. We don't have clear data that says I need to eat different. It's all very individual. Now we know for sure people feel differently throughout their menstrual cycles. We know there's symptoms that come with that. And so that's a lot of what we're trying to focus on. Something that, like I've really focused on is dysmenorrhea or menstrual pain. If I'm in so much pain that I don't feel like exercising, or I'm in so much pain that I can't perform the way I want to, or it's getting in the way of work or my social life, different things, that's not okay. And so, what can we do to modify maybe the inflammation that's rising and happening before that, that's adding to the severity of it? Or is there a supplement I can kind of take to help reduce the severity in addition to, the pain medications? And so that's kind of an area we have targeted. Same thing, like women in general, just first pass should be just start kind of tracking. When does your period happen? How long does it last? Next, you can start adding in, am I experiencing like cervical mucus, which would be a sign of ovulation? If you really want to get into it, you can add the ovulation testing. See if you get that rise in LH. That's not a guarantee that ovulation happened. We have to do the progesterone piece, but it can start giving you some clues on, did that happen, which would be an important sign of health, and that everything's functioning properly. And so then from there, tracking maybe some of your symptoms. And if you're noticing certain symptoms popping up every month, and so my group was just talking about this today, like psychological symptoms, especially. It's hard to tell as a woman, am I feeling this way because it's my hormones? Did I just not drink enough water today? Did I just not eat enough food? Is it the environment, the pressure, the temperature? Like what's going on? It's hard to tell. So we start tracking that though. And if you notice it always happens around this time of the month, it might be a hormone related thing. And so then we can start saying, okay, do I need to just make sure I'm drinking extra water leading up to that and that seems to moderate it? Or do I need to increase my carbs a little bit? Do Do I need to increase my protein a little bit? So those are some high level things I think you can do. In that higher hormone phase, there may be some more inflammation, or the body's maybe working a little bit harder to do things. So we might need to increase calories just a little bit. We're not talking like a whole nother meal, but adding in a little bit of extra. Do I need to really make sure I'm fueling through this, or getting a little extra protein to help that recovery when I may not be recovering as well? So it's really listening to your body. And we just have maybe ways to, if you're tracking, you can be a little more preemptive, knowing that's coming. And then if you start noticing changes, that might be a time to step back and say, what's going on? What's happening in my life and my health that's maybe contributing to that? And so the last thing I'll kind of leave on is the hormones are usually a sign of something else happening. And so it's really, okay, if the hormones are changing, what kind of stressor or thing is happening that's causing them to change, that we can really get at the root cause to help fix it. A lot of times it's an energy, a carbohydrate, life stress, some type of situation there, but they are an indicator and something we can kind of use as a tool to keep track of our health.
Yeah, I think the menstrual cycle, I feel like, is just getting like we're just dipping our toes into the what it's going to become in 20 years, when we're like, okay, we have more exact things. And
Yeah.
so I think one of the best things I did when I was in college was starting to track my menstrual cycle. And 20-year-old Kelsey had no idea that that would prove to be so beneficial, because it is about awareness and trends. And you were saying, like, we all look at our periods, like, oh gosh, I can't believe this happens every freaking month, or whatever it is. And I've started trying to look at like inflammation too. Like, inflammation is necessary in order for our periods to happen, right? In order for us to even like shed that lining. And so some of the times I even look at that in moderation. It's like, okay, my body's doing what it needs to do. Like, I'm having some of these symptoms, but it is cool to think about, like, okay, if it's drastic, if you have this pain that prevents you from exercising in the right way or from going to work, like, forget training, it's like there's times I just, people just want to sit with a heating pad on, so it's really cool that you're doing a lot of the research to help that, and not even help during like the training, but also just like daily life stuff. So
well, I think it's so real too. I think a lot of women have a varying degree of maybe some dysregulation. We talk about a lot of women set in that maybe less severe stage of energy availability. But none of us are really taught what is going on in our menstrual cycle, what's going on with our hormones, where most of us are taught a period's going to happen and it has something to do with reproduction. But when you're young and you're not necessarily trying to get pregnant, we don't really think about it in any of those capacities. And then a lot of women suddenly, when they want to get pregnant and start a family, suddenly they're just like thrown for a loop and realize there's so much to know and think about, and why is this difficult, and I never even knew dysregulation. And so I think it's helping women think about it a little bit sooner. What does it mean? What can it tell me about my health? And kind of embracing it a little bit. I think you're right. In the research side, we're still figuring out the best way to study it and what we need to consider and how much of an effect does it have and in what way. And so, it's an exciting space in the research world. But there's, so many questions. And honestly, right now, like, good things that you're doing, it's just educating women on what even happens in a cycle and what does that even mean for my health as just a normal, healthy person.
Yeah. And awareness, like it's like, okay, a lot of my friends that I talk to, they're like, oh, I don't track this. I didn't even know. And, even I noticed it with like negative thought patterns. Okay. I'm in my luteal phase, like the high hormone phase. It's like, I'm feeling a little bit more down on myself. And once I started realizing that that was something that consistently happened, in that I'm like, you know what, it's not me, that's not who I am. So it's those little things that you can kind of laugh about and be like, aha, silly body, that's something that
but that's powerful, right? Gives yourself room for some grace. And a lot of women we're already hard on ourselves most of the time. So yeah, that's just one less thing, or it gives you some control, right? I think sometimes when so many symptoms are happening or it feels unpredictable, it does give you a grounding piece and the ability to take some control over it, and maybe do something about it. So I think that's powerful.
I know. I could talk about this all day. I've done a series on it. Like I love this. So maybe
Mhm.
we'll have to chat about it more sometime else. But I
Sure.
know we're coming to the end, but is there anything we've talked about a lot and there's so much more that we could cover, but is there something that we didn't cover that you are like very like part of you is wanting young women to know this certain thing? Like is there something we didn't cover today that you're like, I wish I knew this in my 20s and 30s, or if I wish I knew this from a younger age?
Oh man, that's the $1,000,000 question. There's so many things we say, like, if only I knew then what I knew now. Yeah, the big thing I would tell most females, especially if you're like a female athlete or doing sport, fueling is so important. Now is not the time to be restricting, and so much of society will tell you to eat less. But that's just not the truth for when we want to be strong and powerful and compete and exercise and feel good about ourselves. We need to fuel that. So prioritizing that, and kind of changing that narrative. I would also throw in like, don't be afraid to lift heavy and run hard and do the fast, aggressive things. Um, I joke, I feel like there's a big myth right now of like, if I go lift heavy weights and take creatine, like I'm going to turn into the Incredible Hulk or something. I saw a really great video the other day saying, like, making a joke about it, but it was like, oh, we have this big pandemic of women turning into Hulks. It's just not the reality of our physiology. And so, honestly, there's just more benefits to that, especially if you're trying to. A lot of women say, I'm trying to go for the toned look, which that is more about the muscle, than anything else. And so you want to have that good muscle. Um, and so I would emphasize some of that, but maybe those are my two main ones. We'll stop there.
Yes. We could go on and on, but Dr. Katie Hirsch, thank you so very much for joining us. Your research is helping change the world for female athletes and females in general. And I'm so grateful you were able to share some of that with us today. So thank you, thank you, thank you. I love this conversation, and I know we could go on for hours, but
Yeah.
we'll leave it there for today.
Well, thanks for having me on. Yeah, fun to chat.
Awesome. Thank you guys for listening. I hope you guys got as much out of this episode as I did. I'm going to have to go back and like actually take notes now that I'm not like, chatting and talking about it. But I hope y'all got a lot out of it. And I'll see you guys again on the next episode of Wellness Fixes the Pod.